And we appreciate you coming out tonight to join us we have Dr. Neal Rittenhouse, just his formal name being Dr. Neal Rittenhouse, but prefers to go by Neal. And Neal's going to talk with us tonight about wellness services or health services on campus. Before we get started, just a couple of housekeeping notes. We have found that everyone has a better experience if you can keep yourself muted during the session, and then that would prevent echo and feedback. And then if you have not already done so, if you would change your name, you would rename yourself and include your first name and last name so that we can get you checked into our system, that would be great. We would appreciate that. If you need help doing that, if you hover over your square and the 3 dots that show up, the ellipses, if you click on that, you have an option to rename yourself. So if you would do that at some point for us, we would appreciate it. Also, at the end of tonight, there will be a survey posted in the chat, and that survey is what enters these students into the drawings for our prizes for Admitted Student Week. So if you've not done those surveys yet, you'll want to jump back on and do those surveys, and we'll also be sending out the surveys for each of the sessions for participants tomorrow as well. So without any further ado, I'm going to turn things over here to Neal. What we're going to do is Neal's going to talk about the wellness options and health services on campus. And then at the end, Neal's going to answer any questions. So if you have a question, you can put that in the chat, and I'll be filtering those through to Neal as well. So Neal, it's all yours. Take it away.
Thanks, Jarret. Good evening, everybody. I admit this is strange for me. The presentation style that I'm most accustomed to is one where I can see faces up close and personal and react to you and pick up on body language. And of course, we're in a situation that doesn't really allow for that. A couple of caveats before we begin. One, as probably most of your presenters are, I'm coming to you from my home office, which means I have an 8 and a 9-year-old who are currently trying to go to sleep upstairs. And I have a hyperactive golden retriever puppy who's probably going to make an entrance from time to time. So if there's unbridled chaos, I hope that you'll forgive me and we can get through it together. I have a bit of a spiel that I like to give folks that I think will set the audience up for questions, but really I think the questions that come from the audience are the most important part. So from my perspective, the way I organize this is really in kind of a 3-part series. One is, who am I? 2, what is my charge? You know, what is it that I do at Bridgewater? And 3, why do you care? You know, why does that affect you and your student? And so I'll try to answer those and be brief about it. And once I feel like I've created a decent amount of framework, I would prefer actually to turn it over to you, so this can be the most productive time that it can be. And with that, I mean that we can answer most specifically the kinds of questions and concerns that you have about what it might mean for you and your student to be a part of the Bridgewater College community. So to begin, I wear multiple hats, as most of us do at a small private liberal arts college. So I am Dr. Neal Rittenhouse. I'm not a medical doctor. I'm actually a clinical psychologist. And I am also the Associate Dean of Students for Health and Wellness. So there are at least 2 hats there that I wear. One is administrative and one is clinical. The Associate Dean of Students piece is administrative. So in that role, I oversee and provide support to our mental health services on campus, our student health clinic on campus, and I provide supervision and support for our wellness prevention and outreach services. So that's my administrative hat. I also wear a more direct clinical hat. So I'm also the director of our college counseling center, which means that not only am I the director, but I also, it's not uncommon for me to be sitting across from an admitted student who comes into the college counseling center needing to talk about something that's bothering them. And so I try to inoculate students and their parents by saying no matter whether it's with regard to mental health services or physical health services, it's not a matter of if, it's a matter of when. And I think that's my way of taking, or trying to at least, reduce the stigma of receiving services of any sort, whether they be physical health or mental health, because all of you are going to need that at some point in time during your college career. The choice is what you decide to do with that need. I would encourage you to act on it and take me up on some of the services that we offer and that are under my charge at Bridgewater. And so maybe mental health services is a good place to start. I'm a licensed clinical psychologist, and I'm the director of the counseling services. And in counseling services, we have 2 full-time staff, me being one of them. And we regularly employ trainees, which is pretty common practice, actually best practice among higher education institutions. So aside from the full-time staff members, we might have 4 or 5 graduate students who are either earning credits toward their degree where they're pursuing at another institution, or they've already graduated with a degree and they're earning hours toward their state licensure. And that's a really important thing for us because we're able to give back to the surrounding community and to the Bridgewater community at no added cost to the college. So there are a few things that I would want you to think about when it comes to mental health services and receiving them. One would be that they don't cost you anything. So unlike receiving mental health services in a private setting, you're not paying for the sessions there. There are no session limits at the Bridgewater College Counseling Center. Now, having said that, there are limits. There are sort of rules of thumb that we abide by. So if Jane Smith were to come in and she was interested in receiving services in our clinic, I would do an assessment to try to figure out whether we could make pretty significant headway with regard to Jane's concerns within maybe 10 sessions or so. And if the answer to that question is yes, then Jane gets to come on in and we do our best to help move her forward in her journey. If I have big concerns that somebody either isn't going to benefit very well from the short-term services that we provide, or is going to need adjunct services in the community, my preference is usually to refer them to a private practitioner locally so they can get started and maintain a solid relationship with those providers. The best predictor of positive outcome in mental health service settings is actually the goodness of fit. It's not the degree, it's not the number of diplomas on the wall, as much as I would like to say that that's true. It really is the degree to which the student feels like they are understood and cared for by the person that they're sitting across from. And so toward those ends, I try to make sure that that happens, whether it's in the clinic at Bridgewater or whether we're just the agent that facilitates the connection between the student and the therapist or practitioner that's in the community. If you know that you already have, you've received mental health services elsewhere, many of our students also take medication, it's helpful both for us and for you to go ahead and get in contact with us so that we can game plan well ahead of the time that you set foot on campus so that you're not missing opportunities to continue along your mental health journey. We're happy to connect with mental health practitioners that you've connected with at home or else in other places, so that the continuity of care that you receive doesn't feel like it's lagging just because you've changed locations and you've become a student or you've continued as a student. With regard to student health services in a more physical sense, we've changed that programming pretty significantly within the last year or so. Granted, this past year has been not a full year, and in more ways than one, an exception to the rule. We have a student health clinic that is on campus, and it used to be that there were 2 full-time staff members who would provide the care there in the clinic. We've changed that for a number of different reasons. We wanted to expand the number of hours that the clinic was open. We wanted to increase the number of staff members who were there to provide services to our campus community. And in so doing, increase the continuity of care that students will receive in various points of care on campus and off. So we've partnered with Karelian Clinic. They are a mental health organization based out of Roanoke, and they actually have a great deal of experience providing student physical health services in higher education settings. So Virginia Tech is a client, Hollins College is a client, Radford is a client. So it was sort of a no-brainer for us when we thought about making this change to bring them on board so that they could bring their expertise to the table and help us increase the number of services that we could provide to our students in a seamless way. And I imagine that a number of you who either have pre-existing conditions that may need some attending to when you come to college or continue at college may have some questions about what that looks like. You know, what do I do with my medications? How do I transfer prescriptions that I've been prescribed at home to college? And so I can help answer some of those questions. Hopefully most of those questions. The third thing that I wanted to cover is our wellness and prevention and outreach services. Our director of wellness services is actually an alumnus of Bridgewater College. She graduated in high esteem and left and got a master's in public health from the University of Virginia and came back, and we hired her on as the director of wellness. She does a phenomenal job, and I want to make sure that we prioritize that one of the goals for learning for each student who sets foot on campus is one of continued personal development. And wellness is a key aspect of that. So we want to make sure that your student, as they come onto campus, one of the things that they learn isn't just in the classroom, but is key outside of the classroom. To answer questions like, what proactive steps do I need to take to make sure that I'm healthy in a physical way, in a mental way, in an emotional way, and that I can do so with resilience and without too much dependence on our parents. I think back to when I started college. I think I was doing laundry for the first time. I think when I went to pick up a prescription at a pharmacy, I had no idea what my insurance coverage looked like. And so I try to keep that in mind because I use that as a good example of what I don't want our students to encounter. And if they do encounter it, that they quickly bypass where I was in that developmental trajectory and become a more autonomous student and community member, so that they are able to not just be reactive in their self-care, but proactive in their self-care. So again, this isn't a matter of if, it's a matter of when. And it is a matter of when you have the opportunity to engage in proactive and healthy coping strategies when you're undergoing a pretty significant stressor, positive as it well may be, that we're helping you grow in the process. So I hope that in that short spiel, I've helped to answer some of those 3 questions. Who am I? What is my charge at Bridgewater, and why should you care? And so, without belaboring the point, with Jarret's help, maybe I can start to address some of the specific questions that you have as you further consider your attendance at Bridgewater or prepare to return. So what are some of those things that I can help you navigate? I'm looking at Jarret and I can tell that he's keeping a keen eye on the chat box. And listen, to be clear, there is usually a bit of a lull in this presentation because sometimes people feel a little bit reserved, if not outright shy, about asking questions that often pertain to things that are pretty vulnerable and personal by nature. So take your time, and but no question is off limits here.
Neil, here we had a question come in. It says, can you discuss what help that you can offer in terms of medication?
Sure. In some ways, the answer to that question depends on the medication. So some students come in with pre-existing physical conditions. Some students come in with pre-existing mental health or emotional conditions. In either case, one of my primary goals is to ensure a smooth transition. So if you know that you take medication, whether it's for ADHD or a seizure disorder or for depression and anxiety, one of my primary goals is to make sure that there aren't any hiccups in your transition to school. So I think one thing that you can do to help me toward that end is to get in touch with my office ahead of time so that we can start identifying the providers who will be taking over management of those prescriptions, whether they be on campus or off. And so not knowing, of course, who asked that question, if there's a follow-up, please lean in for more specific guidance.
So a follow-up to that came out, and then maybe it's more of a caveat. So the original question said, can you discuss what help that you can offer in terms of medication if a student is already on medication?
Yeah. And so my response to that would largely be the same. It's pretty unusual. In fact, I don't know that I can think of an example where a student has come to campus with a medication that they've been taking on a regular basis that we haven't been able to offer them a way to maintain that medication prescription. It's also not uncommon for students to arrive on campus having never taken medication, whether it be for physical or emotional challenges, that we say, hey, we really think this is something you should consider, and we're not expecting you to go through that alone. So sometimes the role that I play with students is to say, what are you thinking? What has worked? What hasn't worked? And as you consider adding medication to your health plan, can I accompany you on that journey so that you don't feel like you're going at it alone?
Another question that came in, Neil, says, if we see a psychologist, at home or take medication at home, is there a way we can have that transferred to the college? There's been a couple of questions about the transfer of medication to a pharmacy in the area as well.
Yes, indeed. So to be clear, one of the things that I had to learn is the difference in terminology. And it can be confusing. I'm a psychologist, and that means I'm a doctor, but I'm not a doctor that prescribes. So psychiatry are the folks who prescribe. Medical doctors are folks who can prescribe. So to some degree, well, let me back up. In all degrees, I can help connect you with a provider or a prescriber that can continue your medication. Where that deviates has a lot to do with the degree of comfort of the providers in our student health clinic and those in the surrounding community. So the qualifications of the people in our student health clinic are going to be a nurse practitioner, a registered nurse, and a CMA. Two out of the three of those folks can prescribe. Now, it's not uncommon for those designated professionals to say, listen, I'm a general practitioner. I feel comfortable prescribing things for depression, anxiety, etc. And then there may come a limit where they say that's where I'm getting in over my head, and I would likely defer those prescriptions to somebody privately in the community. I have a pretty good idea about where that level of comfort lies. And so when we get in touch before you set foot on campus, I can help you decide or guide you, say, this is probably going to be a prescription that's going to need to be managed by somebody privately in the community. And here's a list of people who I know can do that. Having said that, it is not uncommon, given supply and demand, that psychiatrists in the area may be backed up for 30 days. So it's pretty essential that if you have questions about who's going to continue prescribing for you while you're at college, to go ahead and get in contact with me well beforehand. One other option, just based on the comfort level of your prescriber at home, some prescribers are okay prescribing from a distance. So they may say, hey, Jane, I know you're going to Bridgewater. I'll continue to write refills for you while you're there. And if you have any problems, just call me. Some prescribers will say, you know, I'm uncomfortable with that. I'd really prefer that you transfer to somebody who's local. And if that's the case, I can help you find who that person will be.
Another question, Neal, that says, how do you make campus staff aware of special conditions that a student may have?
Good question. It depends. It depends on a number of things. It depends on how confidential the student wants that concern to be, what sorts of accommodations that condition may need, and how many people may need to be involved in making those accommodations. So are they learning accommodations? Are they accommodations that may need governance by the Americans with Disabilities Act? Are they accommodations that may need more flexible routines and pathways? Each of those questions is going to add nuance to my response. And having said that, we deal with all of them. So there are some times where a student will come to me and say, hey, I have a condition that really needs a high degree of accommodation. I don't really want to broadcast that from the rooftops. Can you help me? The answer is always going to be yes. And what follows that, though, is going to be based on what you're coming to school with. Here's what I think that's going to look like. And are you comfortable with that? If not, let's find a way that we can make that comfortable for you.
The next question says, what does the staff in the clinic look like? NP, RN, LPN, MA, etc.
Yeah. So we will have 3 staff members staffing a student health clinic from Karelian. 2 are already hired. We have a vacancy right now, which is a changeover that was planned from last academic year to the upcoming academic year. So there will be an NP who is already hired and ready to go and trained. There will be a CMA who is in charge more of taking phone calls, registering students, creating logs in the electronic medical record. And the new hire will be a registered nurse. So 2 out of the 3 will be able to prescribe. Our nurse practitioner is technically the director of the student health clinic. And so there will be 3 total staff members in our Karelian clinic.
Along those same lines, it says, can you describe the access to medical attention for more routine needs, such as a sinus infection, flu, etc.? Do clinic visits require appointments? Does BC accept all health insurance?
Great question. So this is one of the other changes that we're considering making. We used to be primarily, if not exclusively, a walk-in clinic. That has its advantages. It has its disadvantages. What we were finding most recently, and granted, my tenure at Bridgewater has been close to 3 years. So my span of understanding of Bridgewater historically is relatively short. What has been happening more recently is that we would have 2 to 3 folks in the clinic, and we would have this this rush of students who might show up at 4 o'clock or 4:30 when the clinic would close at 5, which meant that it was quiet in the morning, and then our providers were having to stay well past 5 o'clock to make sure that they were meeting the needs of the student population. So one of the things we are almost certainly going to implement is, at the very least, a halftime appointment-based structure. So it might look like, certain days are appointment only, or the first half or the second half of certain days are appointment only, and then the rest of the time is walk-in. Or we might just move strictly to an appointment-based system with very limited walk-in hours. That's for the sake of making sure that students get the attention that they need and that our providers aren't bottlenecked with each workday.
Next question says, if you have prescriptions with Karelian Clinic, how can I get them sent to the college?
If you are already seeing a Karelian provider, that's actually good news, because they will be using an electronic medical record that is common across all Karelian clinics. So you will technically already be in the system. So they'll be able to access your pre-existing record, contact your other prescribers and providers. And so it'll be a much more seamless transition for you. Having said that, if you haven't seen a Karelian provider, it'll still feel relatively seamless. Even for students who currently exist at Bridgewater. So you'll be able to sign a piece of paper that gives Karelian permission to look into your record prior to Karelian having taken over the clinic or partnering with Bridgewater, and that should still go relatively quickly and easily.
Knowing that some people have a stigma on, or society has a stigma on, mental health, is there a time that students can meet with you or someone in your office that others may not be able to find out about?
There are a couple of answers to that question. So let me describe the physical space to you. The counseling suite is a smaller part of the student life suite. It's a newer space. Actually, when I was hired, it was still being, furniture was still being brought in. There is a grand entrance to the student life suite, glass door with a seal, very professional looking. All students are welcome to come through that door, and there is an administrative assistant who's prepared to direct that student to whatever office they need to go to, including counseling. There is also a much more discreet entrance that goes straight into counseling, where there is a separate administrative assistant who deals just with counseling. So if a student is feeling concerned about their confidentiality, we more than welcome them to come in the more discreet entrance, which comes directly into the waiting room, and there's a discreet check-in procedure. And Jarret, maybe you can elaborate on just how discreet it is. It's kind of behind the mail room, halfway down a hallway on the first floor, and so it's very easy to be discreet if you choose to do that. And if you choose to come in the main entrance, in many ways that has its own discretion, because there are lots of reasons that people come into the student life suite. There's student engagement, there's tutoring, there's to talk to the dean of students. Either way, we do our best to make sure that any student who comes in to receive mental health services or to consult about mental health struggles feels like they can do so without wearing a scarlet letter.
A question came in and it says, are we allowed to keep our medication in our rooms, our residence rooms? This one specifically says, I'm asking because I'm a diabetic.
Yes, indeed. So that is, a big change from high school. If you attended a public school or maybe even a private school, it was likely that you had to turn over your medications that were prescribed or even unprescribed to the facility, who would then administer those for you. Not the case at Bridgewater. So we trust that that's been prescribed to you, that you're able to administer and monitor those prescriptions on your own. And should you have difficulty, we're happy to assist. Otherwise, those are yours.
Next one says, I have a psychiatric service dog and she is for PTSD and severe anxiety.
Mhm.
I've already gotten her approved by Dr. Studwell and am wondering if I have a psych emergency to the point she can't mitigate it. What are the options for mental emergencies? Is there an after hours call? Could I see someone after hours or call someone?
Good question. So it sounds like this student has already gone through a number of the processes that we would be orienting students towards. So you've met with Dr. Studwell, you've had the service animal or emotional support animal approved. The other part, which may have already happened, is that we would want to make sure that residence life is aware of the service animal's presence. If there's a psychiatric emergency that can't be mitigated by the service animal, both myself and my senior clinician monitor a 24-hour emergency line. That number is not given to the student population at large because of supply and demand. There's no way we'd be able to keep up. That number is given to professional staff and residence life staff. So what typically happens is someone has a medical or mental health emergency. That person contacts the residential assistant or their area coordinator and says, hey, I'm having an issue. That person then calls either myself or my senior clinician. We work with the residence life staff to try to help figure out what's the next best step. And sometimes the next best step is for us to provide some brief triage via phone. Sometimes the next best step is to say, okay, let's check in tomorrow when services resume. Sometimes it's, let's arrange for you to be transported to the local hospital where they have access to resources that I can't give you right now. So all three of those are options, and we tried to assess those options carefully.
Neal, a question has come in and asked for an email address to share with the folks so they can reach you. Which address would you like? And I'll put it in the chat.
Sure. So depending on which service you're looking for, there is counseling@bridgewater.edu and health services@bridgewater.edu. So with the counseling website and the email address, you can use that to consult, you can use that to ask questions, you can use that to make an appointment. That doesn't come directly to me, that comes to our administrative assistant, and she's incredibly capable. So rarely does she reach out and say, what do I do with this? Usually Kristen knows how to take care of it. If it's a specific question that exceeds her level of expertise, or she wants to make sure she's doing the right thing, she'll pass it along to me and say, Neal, what do I do here? What's the best response?
What do students do if they get sick after hours? What are the hours of the clinic? How close is the nearest 24-hour ER?
Okay, so depending on how sick is one thing I would want us to take stock of. So if there is an emergent sickness that needs to be attended to, the hours of the clinic are 8 to 5. And similar to a psychiatric emergency, if somebody became really ill, the first stop on that train would be to residence life staff, because we train them backward and forward. So they will know exactly who to come to, who to call. The nearest hospital emergency room that we deal with on a regular basis is Centera Rockingham Memorial Hospital. And so I would estimate that is a 10-minute drive from Bridgewater. So depending on the level and the magnitude of emergency, we might call the Bridgewater Fire Department or EMS to transport the student to Centera. Sometimes it's the case where they're sick, but they're not emergent. And so they might say, well, can my friend just take me to the emergency room? In those cases, we say, yeah, if that's called for, yes, have your friend take you. And here's a number so that you can keep us updated on how it's going and whether you need our help getting you back to campus and when you're returning. So it depends on magnitude and time of day and to what degree you need emergency services provided.
How close is the closest urgent care facility to campus?
Depends on the time of day. Just down the road from Bridgewater's campus is a combined Karelian and Centera outpatient clinic. I don't know their hours offhand. I think they're similar to our on-campus clinic. So for anything outside of those hours, you're looking at going to Harrisonburg. So Harrisonburg, depending on the part of Harrisonburg, we're looking at a 10 to 15-minute ride to either an urgent care, an emergent care, or a hospital emergency department.
Neal, I'm not sure you can maybe answer this next question. It revolves around, it says, since there is a shortage of PPE, masks and such, will masks be provided / required for on-campus or the clinic next year?
I wish I knew. It is a really timely question. I had a telephone call with the head of Karelian Medical Services just yesterday. And NACHA, the National Association for College Health, has also put out some guidelines, as has the NCAA, as has Centers for Disease Control and Prevention, as has Virginia Department of Health, to help us all figure out who do we turn to when we're trying to figure out what the beginning of school looks like for everybody in the fall, whether it's in person, whether it's staggered, whether it's distance learning. Are we going to require masks? Are we going to encourage them? And aside from that, without a doubt, we have to make sure that our medical providers, both on clinic and off, are equipped either by the state or by private entities with the sort of PPE that's absolutely essential to keep them safe and to keep you safe.
If a student athlete is injured participating in a sport, NCAA sport, how is the injury handled? Through the student insurance, through BC's insurance, or both?
Well, one of the good things about the Karelian Clinic is that there's an enormous list of routine services that are provided at no charge. So we are not looking at whether you do or don't have insurance for most routine procedures. The other, I think bragging point for Bridgewater is that it has a really healthy and well-staffed athletic training department. And so whether it be a sprain or a break or an injury of some sort or a head injury, we work in conjunction between our student health clinic and our athletic training department to figure out who manages that injury and how much attention it needs. So in either case, I anticipate that it's unlikely, unless it's a really severe injury, that you're going to incur a cost unless you're transported to a major medical institution. And in all likelihood, it'll be handled in-house.
How close is the nearest pharmacy?
Up until recently, you probably hit it with a stone from campus, and it was a family-owned pharmacy in the town of Bridgewater. That has since changed. They decided to close up shop, and so we actually have a running list when that change was made of pharmacies in order from closest to furthest away, and which pharmacies deliver to campus, and what the stipulations are around when, what days they deliver, and whether there's a cost or fee associated with that. CVS has several locations that are close, both in Harrisonburg and Dayton. And so I'm trying to think in terms of miles and in distance traveled, we're still looking at 10 minutes or less.
Walmart there on 42 and Dayton would be the closest.
Right.
Is the clinic able to handle different types of seizures?
Yes and no. Full disclosure, I have a seizure disorder, and I didn't know about it until I had a seizure on campus. And so, you know, they dealt with it as I would have hoped. They didn't try to field that in the student health clinic. They called the rescue squad and had me transferred to a hospital until they could figure out what was going on. And it is the case that we have students who join our campus community who already know that they have a seizure disorder. In terms of management, it sort of depends on what management looks like for the individual student. So in my case, my seizures are very well managed. I take medication every day, and I haven't had a seizure in over a year and a half. Some students have a different relationship with their seizure disorder. So again, residence life is a crucial component to campus management of any medical or mental health need, especially if it is unpredictable or after hours. So to the degree that any student feels comfortable, I encourage you to reach out to me, to reach out to Residence Life, to reach out to the clinic directly, to share that, hey, this is what I'm managing, either medically or from a mental health perspective, so we can try as best we can to anticipate what kinds of services we might need to have in place should a student have a seizure while they're on campus.
Neal, excuse me, Neal, that gets us through all the questions that have been posted up to now in the chat.
Those are really good questions, by the way. You know, when I think back to what sorts of questions I've answered when I've had this kind of interaction in the past, I'm not sure that they've been this astute. Good for you.
Yeah, I appreciate everyone's willingness to engage in this topic and to participate with it. I'll put out a call, sort of a last call for any other questions that you may want to ask Neal. I have posted the survey link there as well, so when you get a chance, please do that. We appreciate you coming out tonight and joining us for this session, and if you were in the previous 2 sessions, thank you for doing that. A shameless plug, we have more of these sessions going on the next 2 nights as well. So over the next 2 nights, we have a student panel, an alumni panel, a Kahoot trivia night, where we have some prizes lined up that participants can win. And then to end it all on Thursday evening, we have what we're calling our open Zoom hangout that students can come in and talk with other entering freshmen, first-time students in for the class of 2024. So thank you all for.
While Jarret's putting out that last call, I wanted to encourage you to do something that I encourage professional staff to do. So when I train RAs and ACs and other residence life staff, one of the things that I say to them is familiarize yourself with the spaces that you're likely either to partake in or to refer your peers and fellow students to. That includes you. I would encourage you, even if you think you'll never use the counseling center or the student health center, go there anyway. Stop by my office, say hello, either for your own sake, or you'll have a peer that says, gosh, you know, I'm struggling. I think I might want to go to the counseling center and I'm scared. I don't know what that's going to look like. That's a really common thing that we have happen. So you get to be good stewards to your peers just by coming through and saying hello and looking around and saying, hey, I know exactly what it looks like down there, where it's located, what it's going to feel like maybe when you go in and make an appointment. So don't hesitate to come by. You don't need to be in crisis to come through and say hello. I mean, I like our space, don't get me wrong, but you know, we're in a basement with no windows. Come by and say hello just for the sake of saying hello. And if you have any questions that I didn't answer, or you're like me that, you know, Jarret closes the Zoom meeting and then you go, oh man, I had questions that I wanted to ask. My email is jrittenhouse@bridgewater.edu. And so even though my name is Neal, Neal is my middle name, Jonathan is my first name. So that's the jrittenhouse@bridgewater.edu. Don't hesitate to email me with questions that you either forgot to ask or that you didn't get a thorough answer to. I'd be happy to hear from you.
Alrighty, guys. Thanks again for coming out tonight and joining us. And if there's any other questions, feel free to either stay on and you can ask Neal one-on-one, or you can post in the chat and we'll get it answered.
Thanks to all of you.
How is the puppy doing, Neal?
He's probably lounging somewhere, but yeah, he's hanging in there. He is, after all, a puppy.
Yes. I don't know who's going to have a harder transition when all this sort of releases. Me and Whitney, the dog, or the kids?
Or all three. Yeah, I think
Yeah.
about Oscar enjoying having all of us here all of the time, and then all of a sudden one day, hopefully it's staggered, we give him a little bit more time.
Yeah. I think Draco will be glad for us to go so he can sleep peacefully throughout the day. At let's see, Wendy and I have been married since '03, so that's 17, going on 17 years. He is 12, 13 years old, so he enjoys sleeping on the couch all day and not being bothered too much.
I think if I were him, I'd do the same thing.
Oh yeah. Oh yeah. Gets a little embarrassing when you're on a Zoom call and the dog is snoring from the next room. You're like, I need to take care of something. I'll be right back.
Get your stuff together, pal.
That's right.
We're live. Do we have any other folks who are you think are set to ask questions?
I'm not sure. I don't see any coming in right now.
Okay.
I think there was one that just came in, Jarret.
Yes, here we go. Good call. Good catch, Kristen. So if you've got a question on how you handle control medicine and what local pharmacies are available.
Yeah. So controlled substances, we rely on the students to whom they're prescribed to manage those. We have had cases where students didn't feel like they could manage a controlled substance and desired some assistance doing that. If that's the case, we can arrange for that. But in terms of controlled substances, we don't proactively take extra control over that process. We rely on the student to share that with us. And the local pharmacies, as Jarret mentioned before, probably the closest is going to be Walmart. And so Walmart and a number of CVS pharmacies close by to the campus, which I would estimate are 10 miles or closer, who can all handle controlled substances.
Another question, Neal, is the birth control shot offered at the health center, or would I have to go to the hospital?
That's a good question. The contract that we have with Karelian Clinic lists every single procedure that is included. And I'm not sure if the depot shot is included or whether there is a charge for that. And so I would encourage that student to get in touch with me directly, keeping in mind that because of the pandemic, we're having to really kind of revisit and revamp our contract with Karelian to make sure that we are doing all that we can and not passing on unnecessary costs to students if we don't have to.
Yeah. Okay. Is there an Air Force base anywhere near campus?
I think the closest Air Force base to campus is probably going to be in Eastern Virginia. So not super close. Langley Air Force Base might be closest to Virginia. I'm not sure if there's an Air Force Base in West Virginia that may be closer, but I suspect you're looking at least 3 hours
Yeah,
or more.
that would be my guess as well. I don't think Sugar Grove. Kristen, do you know anything about Sugar Grove over in West Virginia?
It's shut down.
That's right.
It's no longer.
Yeah, so it would be one of the Langleys over in the Newport News area or Andrews in Maryland. They're probably about the same, sort of that
True.
Fort Meade, Andrews Air Force Base. They're
I
together.
think you're right, Jarret.
I don't know if there's anything closer in North Carolina or not, but they're probably nothing closer than 3 hours.
Probably not. Yeah. Anything lingering, folks? I hope, like Jarret said, you'll take part in the other Zoom meetings that we're offering. It's really important to us that we maintain a positive connection, especially when we're not able to connect physically. So I really would encourage you to attend.
Okay, that looks like
And
it's
then
just.
there were 3.
Yeah, I just put the last person in the
Oh.
waiting room. So
Okay.
Well, from your experience, both of you, Kristen and Jarret, did that feel okay?
Neal, I thought that was great.
Okay.
I do. I didn't know what to expect coming into it. I don't know that I've ever really heard the sort of wellness sort of spiel before.
Yeah.
And it felt very good, sort of in terms of presentation of you sitting there and talking rather than a PowerPoint and a this and a that sort of thing. You know, I thought it went real well.
Well,
I'm
I'm glad.
pleased with.
I welcome the feedback as much as you're willing to give it. I think I saw, Jarret, that you recording this, and so this may be helpful. I know Chase Hale in graduate studies wants me to do something similar.